Guys, welcome back to Medical Coding with Blue. Today's episode is all about before you quit your medical billing and coding program. Watch this. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, if you follow me on LinkedIn, you know that I have been campaigning the last couple of weeks about not listening to everything that you hear, not believing everything that you hear without doing your own research first. And this message that I got, which is going to be about today's episode, sort of speaks to that, because this is what happens when you listen to other people who don't know what they're talking about, okay? And how it can affect you if you allow it, okay? So let's get into it. Here's the message. All right, the message says, thank you. I'm midway through a coding course and on the edge of just giving up. And this person is in a good program, by the way. I work full-time, have a life/family responsibilities to take care of, so I get about 1.5 hours per day to go through my lessons and study. No real outside encouragement. Got a 70 on my last quiz. I'm hearing, watch this now, watch this. I'm hearing that there's no jobs from others. I'm hearing the pay is so low and the cost of books, tests, and certs are just so expensive. I live far from a testing center, and I'm hearing that the remote testing requires the purchase of a camera and having a private workspace, which I don't have living with family in an apartment. I'm thinking this just isn't going to work, even though I do like, put in big letters, like coding. Just losing all confidence I have, the time and ability to be successful. I'm grateful for your pep talk. I work full-time now in another industry, and this particular job may be going away, which is why I'm doing this as a career change before I actually do get laid off. Okay, so let's break down this message, because there's a lot to unpack here. So I'm going to go back to the first thing, and it kind of makes me laugh. I laugh because of the simple fact that if you really want this, you will make the time for it. You will do whatever you can. You'll get your family involved. You'll get them on board, either to support you with studying or to leave you alone when you're studying, or you will get up extra early or go to bed extra late so that you can get that study time in. Because remember, when you are around your family members, you're raising small children, you're raising teenagers, or whatever the case may be, they're looking at you and how you respond to this adversity that you're facing. You know, going to school as an adult is very difficult. It's very different from when we're children, right? Children, you know, you can be in school and that's all you got to focus on. School, sports, drama, whatever you want to do, right? Drama meaning theater, I mean. But you can focus on all that, but when you're an adult, now you've got extra and added responsibilities. And sometimes you may have small children, sometimes you may have teenagers. But here's the thing, they're watching you. They're watching you to see how you handle this. Are you able to manage all of this? This person is making excuses. This whole thing right here is a whole list of excuses. Because the first thing that says that they get about 1.5 hours per day. So that means instead of getting 20 hours per week, this person's getting about 8 hours a week. About 8 hours a week, if that, because again, you've got excuses that you're being made, right? So you're only getting 8 hours in, and then you're saying, boy, I got a 70 on my test and I got no real outside encouragement. No one needs to encourage you. You have to learn to encourage yourself. That's the first and foremost thing. Yes, I do offer, my pep talks here, motivation, get in there, get it done, let's go, let's get to business, instead of feeling sorry for ourselves. That's what I talk about here. But at the same time, you have got to be able to do that for yourself. There's a lot of people that don't know how to do that. And so that's why I spend the time on my channel to tell you guys, you have to learn to be self-sufficient. You cannot expect somebody to come and rescue you. No one will come and rescue you. You have to be willing to say, okay, you know what? I'm going to learn to be self-sufficient so that when my children are looking at me, they know, okay, my parent, my mom, my dad is really, they may not understand it right now, but when they get older, they will understand. My parents did everything they could so that I could have, and they went to school and they still worked a full-time job and all of these things, right? So that's what they need to see. They don't need to see you sitting here making excuses. Well, I can't because of my kids. But meanwhile, I bet you money you're on TikTok, Facebook, Instagram, Twitter, Snapchat, all these other things. You're on all these things, but you don't have time to study. When studying involves multiple ways of learning: visual, auditory, and of course the book itself. So when you're at work and you say, well, I work a full-time job. When you're driving, you have all of that time that you could be listening to the HIPAA channel on YouTube. Don't ask me. Y'all can find the HIPAA channel on your own. You can just Google HIPAA, okay? And you'll be able to find a bunch of things on YouTube about HIPAA. Anything else that you want to learn about, okay? Present on admission. Anything that you need to learn about, you can learn on YouTube. And you could be listening to that in the car on your way to work, right? That's 30 minutes. Let's just guesstimate it's going to be 30 minutes anyway, right? Then your lunchtime comes. You could be listening to the guidelines. You could be doing flashcards on Quizlet. You could be doing any of those things. But no, you want to sit there and visit with your coworkers and do all these things, right? Or no, you don't have time, so you don't take breaks. No, you need to be able to take your break when you're at work. You have to make that time when you are at work to take your break for lunch. And you could be listening to something. You could be going through flashcards on your phone. Okay? There is no excuse. On the drive home, that's another 30 minutes. You could be listening to something instead of listening to whatever else you're listening to. That's already an hour and a half you've already put in. And then this hour and a half that you claim that you do at night, all right? You get home, you do another 1 hour of study, and you do another 1 hour of study, because I know you're not spending all that time with those kids. And even if you are, do you think that they're really going to always need you all the time? They need to be able to do things for themselves as well. I've said this before because I was talking to another lady. She's Hispanic, so we're both Hispanic. We understand, right? And the lady says, oh, Blue, I feel so guilty. My son, I feel like I'm neglecting him when I'm studying. I said, oh my gosh, how old is your son? She goes, he's 16. Ma'am, if he's hungry, he can make himself a sandwich, okay? He can make himself a bowl of cereal. He'll be okay. And with these kids and their phones and everything else, they're entertained. They don't need you to constantly be doing things for them. They need to learn to do things. That's why there's a whole generation of these kids coming up that can't do things for themselves, or they have so much nervousness because they can't do anything because their parents are right there trying to do everything for them, instead of letting them do it for themselves, so that way when they get older and they can fly birdie fly. You see a lot of kids at home with their parents. And I understand we're living in a different economy now. I understand that. But at the same time, if you are letting them figure stuff out, do that critical thinking, problem solving on their own, trust me, that's going to make them a fully functional adult, which is going to help you in the long run, because you need to be able to do things and they need to be able to see, because you're modeling that behavior. You're modeling what a good adult does. And a good adult who has decided to go back to school because they want a better career and they want a better life, that needs to be shown. So you need to make the time. If your kids need you, fine, hold the flashcards, or let's do some drills together, okay? Oh no, the kids don't want to do that. Guess what's going to happen? They're going to evaporate and they're going to go and do whatever it is that they do. And you could be right there in the living room or the kitchen or wherever you're at doing your studies, and everybody's happy. Everybody's happy. But again, it sounds like excuses to me. And I've heard, and before you say, oh no, Blue, you don't understand. No. I do understand. I've had parents who say, Blue, I have 2 kids that are disabled, but you know what? I'm still studying. I'm still able to do these things. I made it through the school. I passed my test because I followed your advice, and now I have a job. I have a career. I can support my family. So what about you? What about you now, right? So where's the excuses? If they can do it, why can't you do it? You don't have to take on all of that responsibility, especially if the kids are a little bit older, because they can have some of that responsibility. Okay, they can be able to do things for themselves. They can make themselves a sandwich. A sandwich is not hard to make. A bowl of cereal is not hard to put together. Okay, it really isn't. So that you can have the time to be able to do what you need to do to study, so that you can get the time in, so that you can make better grades than a 70, because you are better than that. And the other thing is, I'm hearing there's no jobs. So why did you even get into the program to begin with if you hear that there's no jobs? Because when I look on Indeed, on all of these other places that have job listings, when I go to the AHIMA job bank, when I have looked in all these other places and I see all these jobs for coders, so gosh, that means there's no jobs for coders? The other one is, I'm hearing the pay is so low. You hear the pay is so low. Okay, so I don't know where you're hearing this pay is so low. Because when you start off new in any industry, you are going to start off with what the minimum pay scale is, and then you work your way up. People have this delusional idea, and yes, I do say it is delusional, because there are people that are coming in that want to make 6 figures right off the bat, because they think that that's what they heard, and if it's not that, then it's not good enough, without trying to work their way up. And so you getting into it already thinking about the money, the job, doing all these things, and you're not even through the school yet. You're not even through the school, really? So let's just back up a few steps here. First of all, we never talk about money and specifics on my channel, never have and never will, because I don't need to fluff up my views by doing that. But let's look at this rationally. Yes, the field does pay well, but you have to earn it. You're not going to come in making what you made from your last job and making it, oh yeah, I'm going to make the same amount of money. No, you're going to go back so that you can move forward. And let me tell you the story again. When I first started, I started off at a very good rate. I was like, okay, this is great. Then my pay bumped up. And then my pay bumped up again. In the same year, I got three different pay scales. All really good. But I was like, oh, okay, well, this is fantastic. When you don't concentrate on the money will come to you. It's people like this that are concentrating on the money. Oh, I hear that it's not going to work out so well, right? So, and the other thing is, the cost of the books, the test, and the certs is so expensive. Okay, any field that is going to pay you really well. Let's look at all these professions, right, that are out there. Of course, you have doctor, you have attorneys, you have plumbers, electricians, you have, all these things that require continuing education units. It requires you to sometimes be a member of the association. I don't know what certification this person is going to be sitting for, but they mentioned about doing the remote testing. So I'm going to take a shot in the dark and say, oh yeah, this is probably going to be the CPC. So again, if you had done your research, you want to talk about, oh, it's so expensive. All right, if you're going directly to the association that requires you to be a member every single year, requires you to pay that membership fee, regardless of whether you have a job or whether you don't have a job, of course it's going to be expensive. But if you look at AHIMA doesn't require you to be a member, number one. Number two, they do charge you to be able to report your continuing education units. And why do we have to have continuing education units? Because the industry changes every year and we have to stay educated. And not only that, being able to keep up with all of these things, the membership and the CEUs and all of this stuff, certain employers will pay for those things. So why are you worried about it? A benefit of my employment is that I get 1 CEU a month. So I get all of these free CEUs. Not to mention that I spend my own money to go to conference so that I can get even more CEUs. But if I only had the 1 certification, I would be able to have more than enough CEUs based on all the things that I do at work. And that doesn't cost me anything, okay? And again, there are some employers that will pay for your membership. When I worked at home remotely, I did get that. That was a benefit of my employment. They did pay for me to have a membership with AHIMA, which I thought was really nice. You pay it and they pay you back and do all these things. So that's keeping their employees educated. But again, it's something that you don't know because you're just too busy listening to all these other people who are clearly ignorant. So then we have, about the remote testing, right? Or the certs, right? Of course, you have to pay for that. You have to pay for these certifications because you're getting into an industry that requires education. You're getting into an industry that is constantly evolving and changing. There's a lot of things that go into these fees and why it's so high and all of these things. But there's also the fact that if you only have one, like I tell y'all, for the first 2 years, at least you can get your footing when you're brand new and you can figure out what you want to do. But no, a lot of you want to sit here and say, oh, I want to get this credential, that credential, this credential, that credential. And meanwhile, all these other credentials are already saying the same thing when you have one of those 4 main medical coding certifications, the CCS, the CCA, the CCSP, or the CPC. But no, y'all want to keep up with the Joneses and be able to get all these other things too. When having only one credential is, you're going to get paid the same thing as somebody who has only one credential. Meanwhile, you have 3 or 4 or 5 credentials you know nothing about because you're just told just to get these. It's just like when those people tell me, oh, my teacher told me I needed to get the CPMA. Why? You've never been audited before. You don't understand the auditing process. What are you going to do with the CPMA? Well, I don't know. I just was told to get it. People, come on. Really? So if you have one certification, you're good to go as long as you maintain it. As long as when you are applying, you're saying, okay, are the memberships included when I'm applying for this job? What about continuing education units? Do y'all help with that? These are normal questions that you can ask an employer. And a lot of employers are going to have these because they're trying to remain competitive with other employers. All right. So that's my thing on that one. And then I live far from a testing center, and I'm hearing remote testing requires a purchase of a camera and having a private workspace, which I don't have living with family in an apartment. And see, here's the other thing that this person clearly doesn't know. A webcam is $30 on Amazon. You can get one probably a little bit cheaper, but a $30 one is the average cost. $30 for an external webcam. All right. You have this, and then, oh, I don't have a private workspace. There is a bedroom or something in this house, right, that has a door that can close, because you don't have to be all like, oh, it's an office and things like that. No, it just needs to be a bedroom or a room that has a door that can close, that nobody can come in and see what you're doing or make any other kind of noise. As long as you have a door that can close, that is a secure space, and you can be able to take your test. I've taken tests remotely before, and they will have you scan the room with your webcam, and they will say, okay, if there's a TV in the room, is the TV off? Is the doors closed? And when you show them that the doors are closed, and then you have the camera's right there facing you, and you're taking your test, and that's it. So here you're worried about something that is only $30 for a webcam, and all you have to do is be in a private room that you can close the door. And this is an issue. Why? Again, all of these things that this person says, I'm hearing. So this means to me that all this time that you spend listening to this garbage, right? Because that's exactly what it is, just garbage. You're listening to all this garbage. You could have been studying. But no, you want to sit here and listen to all these people discourage you from your dream, or discourage you because they say, oh, it doesn't pay enough, or I can't get a job. Why can't you get a job? Probably because their resume is messed up. Probably because they can't pass a Tinkle test. Probably because they can't pass an assessment test. But they don't tell you that. But you're busy listening to them. You're busy listening to the garbage that's out there. And it's real easy for misinformation to be spread anywhere, right? I don't understand. Because the CCS covers inpatient coding and it covers outpatient coding. It is a mastery medical coding certification, and it covers both. So if you run around and you tell people, oh, the CCS is just for inpatient, the CCS is just for if you want to do hospital coding, And meanwhile, people see, okay, well, the CPC is just outpatient coding, so I have to get that one too. And then you're running around with people who have 2 credentials when only one is necessary. Because, again, they're trying to sell a credential, they're trying to sell a program, they're trying to sell this, they're trying to sell that, or trying to cater to the person's ego and say, oh yeah, if you have 2 credentials, you'll get hired faster. No, you won't. No, you won't. Because I've seen plenty of people who have a whole conga line of credentials crying because they can't get hired. Why can't you get hired? Probably because your resume's messed up. You can't pass an assessment test. You can't pass a Tinkle test. There's all of these reasons why people can't. And on my channel, I have all of these videos about how to study, how to get more time into study, resume tips, all of these things. And people still act like I'm not saying anything, because they still come out with things like this. And that's the disheartening part to me to see, is people like this that want to cry and get upset about those things when it's not necessary. It's not necessary at all. I seen another one on LinkedIn crying because they said that they're getting all these degrees, got their bachelor's degree. Now they're bragging because they're in the master's program. And, oh, I still can't get a job. Poor me. I'm in these associations and I still can't get a job. Not one time did you mention what your resume is like, or what kind of jobs are you applying for, or what are you doing? Because you're getting into an industry and you have no clue of what you're doing. You want to get into a leadership position, but you have no idea about what this industry entails. Because if you did, you would have been hired by now. I'm just saying. I don't understand the self-pity that I see a lot of times people have. And if you have that, you need to shake that off. Because self-pity will do nothing but destroy your dreams and destroy the plans that you've made. And you may start working and it may not be the highest pay that you've ever had in your whole life, or maybe it might be a few dollars back. But let me remind you guys of the story of the nurse. She's a nurse. She is a nurse who went through my self-study, independent study list. She did the whole thing. She studied, she got her credentials, then she took a pay cut. She said, Blue, I took a pay cut, but you know what? I looked at it like paid training. And from there, she worked her way up and she got into CDI. And within 2 years, she's at a position making even more money than she made as a nurse doing CDI. The thing that she wanted to do. But she didn't come in with unrealistic expectations like a lot of people are. So can we stop with the unrealistic expectations? Because that doesn't work, guys. These unrealistic expectations, making excuses and just wanting to just give up. Oh, because that's easier, right? It's easier to just give up. It's easier to listen to people who don't know what they're talking about without doing all the research yourself, because that's easy, right? And oh, you know what? They're right. And my family member this and my family member that. When your kids get older and they leave the nest and they leave and they do all these things, and then all these people that you spent all these years taking care of, they're on their way to doing all of their own things. And now you're left doing nothing because you kept quitting on everything instead of seeing it through. I'm so tired of people quitting on things and not seeing things through. Just because it gets a little hard, just because it gets a little bit uncomfortable. Well, that's the beauty of being in this kind of industry, is that once you get out of that, once you work yourself out of that, you'll be stronger than when you started. But you'll never get that strength. You'll never get to that place in life where you say, you know what? If you love what you do, you never work a day in your life. I feel that I have not worked since 2014. And let me remind y'all, this is 2024. So that means for the last 10 years, I have felt that I am not working. Yes, I do have things at work that are work. Things that I don't enjoy, right? But you do them. But for the most part, I wake up, I'm excited to get to work. I'm excited to work with my providers. Granted, it's not always like that, but the majority of the time, it is. And the only way you can ever get to that is by going through these storms. Going through and saying, you know what? I've got to beef this up. I'm only working 1.5 hours on my schoolwork. I need to beef it up. I need to make sure that I keep going and doing all of these things so that I can get my time up, so I can get my grades up, so that I can understand what's happening. Because like I said, this person's going through a good program. No, I will not tell y'all what the program is. But they're going through a good enough program. And again, if you are not taking advantage of all these things and this time to learn and actually enjoying the process instead of listening to other people, because that's a waste of time, listening to other people complain about how, this is going away, blah, blah, blah. You have no idea what you're talking about. They've been saying that since before I started. And that was in 2008 when I first got certified. I'm just saying, you can't always believe what you hear. You have to make sure that you're doing your research. You have to make sure that you are actually taking the time to look up the answers yourself and not just depend on other people to spoon feed you. Let's stop with the spoon feeding, folks. Okay? Let's stop with the spoon feeding, because you can do your research. You can. You absolutely can. And trust me, when you start doing that and you start learning more and finding out more, the process becomes a lot more fun. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Yes, this was tough love. I probably lost some people. That's okay. Because again, my channel is not made for everybody. And that's all right. It's all right with me. Because if I was always doing everything like everybody wanted, then I'm doing something wrong. And I 100% believe that sometimes we have to be reminded of these things. Sometimes we have to be reminded that self-pity is the worst thing that we can ever do to ourselves. That all of the things that we want to do are absolutely possible with the right mind frame and the right mindset and the right energy around us. If people are being negative, get out of that negativity. If you are on Facebook and you're in these stupid Facebook groups that are not supportive, my Facebook group is so supportive, Blue. No, I don't think so. I've seen a lot of them. I do have a Facebook group for Medical Coding with Blue. Oh, but trust me, I watch that stuff like a hawk. Because some of those people, they get on there, they try to be like, no. We're not doing that. So I will say that mine, for the most part, is quality. I'm just saying. So, with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.